2 weeks into San Francisco's COVID-19 response, I was deployed to enforce the new health order prohibiting visitors in our safety net hospital. Though that hospital was my home, I worked for the city, and I had sworn an oath to serve as a disaster service worker, back when that concept was just words on a page. For weeks, I stood there in the hospital lobby, maskless, in a sea of heartbroken people, and wave after unrelenting wave had to turn hundreds of them away every day. Away from their loved ones in labor, away from their parents receiving chemo, away from their children in emergency surgery, their best friends terminating a pregnancy. I asked them to go home, where they would be safer from infection. I explained we didn't have enough masks to go around. I let this sea of suffering strangers know how deeply sorry I was, how I wished that there was more I could do. And I lamented that I didn't know how to fix the system that was supposed to be serving them. I came home each day in tears, crumpling onto the floor, wounded beyond words. This slice of hell will always be with me. It drives the work I do with leaders and teams every day. And I know many of you face far worse and have stood for far longer, doing the unthinkable, the heartbreaking, the often thankless work of healing and helping those who need us most. But here's the thing. Helping doesn't have to hurt. Mission doesn't need to mean martyrdom. Our impact does not have to come at the expense of our humanity. In fact, the more human we are, the more impact we can have. By building our inner resources, we build strength not only to endure our burden, but to convert those challenges into gifts well worth what they have cost us. Self-care is not a substitute for structural change. It is how we resource ourselves for the struggle. We must be as dedicated to serving and healing and leading ourselves as we are to serving, healing, and leading others. The only way our mission thrives is if we do. And despite the glossy brochures touting sleep, yoga, healthy eating, this epidemic can't be stopped with wellness programs alone. It demands a leadership revolution. A revolution in how we lead ourselves. A revolution in how we lead each other. A revolution in how we bring the humanity back into healthcare. We must change how we relate to our own thoughts, how we listen to our bodies, how we honor our emotions. We must create safety on our teams so that we can name what needs changing and unite across our differences to change it. We must show our people how much they matter to us, and we have to start with mattering deeply to ourselves. Burnout isn't the problem, my friends. It's a symptom of an underlying disease. Burnout is about systems that have forgotten people, people who have forgotten themselves. What if every process and every person in your organization truly put patients and the people who serve them first? What if every leader at every level was as fiercely dedicated to serving and leading themselves as they were to serving and leading others? What if every team member felt invested in, and empowered to contribute to meaningful change. Now that is a leadership revolution. That is a burnout treatment plan worth investing in. And it starts with you, with each of us. What change could you create if you were as fierce about serving yourself as serving others? What could your organization accomplish if you treated this epidemic of burnout and disengagement with even half the same urgency and skill and care as you brought to your COVID-19 response? I believe we can do better. I believe we have what it takes. I believe you can. Walk with me and find out.
Hi, everyone. My name is Denise Brown, and my organization is the Caregiving Years Training Academy. I began helping and supporting family caregivers in 1990. I launched one of the very first online caregiving communities in 1996, and I continued to manage it for 24 years until I sold it in March of 2020. I now really focus on leadership development programs, training programs, and workshops for family caregivers, former family caregivers, and healthcare professionals. Much of my work really is inspired by 3 concepts I've developed over the years: the 6 caregiving stages, the 12 caregiving fatigues, and the 17 caregiving systems. So let's take a look at what those are. And what's great about these concepts is they can actually be tweaked depending on who's in the audience. So we think about 6 stages that really reflect that family caregiving experience, from when they first start to worry someone in the family might need help to 2 years after a caree's death. What we've also discovered is that these stages can apply to a direct care worker experience or anyone who serves patients. We go through stages. What's interesting is that it doesn't depend on the setting, doesn't depend on the location. It's about the experience of that individual providing care, whether it be a family caregiver, a direct care worker, or a healthcare professional. In many ways, when we provide care, we're in an emotional journey. And so the stages concept really looks at how do we feel? How do we cope? What can help us? Okay, so I've listed 12 caregiving fatigues, but I want to let you know that there's actually more than that, but we have to put a cap on the fatigues at some point. So I picked 12. I should also mention that there are books for each of these concepts, the stages and the fatigues. I came up with the idea about being specific about our caregiving fatigues during a conversation with a training program participant in our certified caregiving consultant training. So that CCC training is for those who want to coach family caregivers. And the training program participant was talking about caring for her mom and how her mom could no longer seem to cope with little things that went wrong during the day. And I thought, oh my gosh, her mom is coped out. She's lost her husband, she's lost her independence, she's lost her good health, she's lost her friends. No wonder she doesn't have the reserves to cope with a meal that's 10 minutes late. Once I started thinking about coping fatigue, I thought, you know what? I think compassion fatigue is actually an umbrella term, and we have to get specific about what wears us out. And that's the caregiving fatigues. So we get tired of bad luck. So in a personal caregiving situation, we can feel like just that is enough bad luck. And then we get a flat tire on our way to a doctor's appointment, or we lose our job, or something else happens that we think, oh my gosh, this bad luck is too much for me. We get tired of supporting all the people in our life that we really want to support, but it can feel like too much on some days. And then we get discouraged from trying to find a solution that we just can't find. And then we get really worn out from trying to get along with our caree, for instance, when it's a bad day for both of us, or trying to get family members to agree, trying to get family members to overcome their denials so we can be realistic about next steps. And that can happen within systems too. So direct care workers have their own type of fatigues as well, including cheerleader fatigue. You can do it. Come on, I'm with you. So the fatigues allow us to get specific about what's wearing us out so that we can create a strategy to feel better. And then the last concept is the 17 caregiving systems. It's really this idea that within a family caregiver experience, we navigate all these systems. A direct care worker navigates them as well as other healthcare professionals. For a family caregiver, he or she might be navigating several systems at the same time. And if you're a healthcare professional supporting family caregivers, it can help to have that insight. So for instance, discharge day from a hospital requires that the family caregiver navigate multiple systems. So it makes sense that they're navigating the healthcare system and the medical system, but they're also navigating the payer system because Medicare or the insurance provider said, this is it. And then they might be looking to the payer for additional help at home or in a short-term rehab facility. They could be navigating the relationship with their caree, trying to figure out how do we get mom in a good place, knowing that she's not going to go home yet. We're transferring from the hospital to a short-term rehab facility. And it could also be, I need to get back to work. So we've got to get this discharge moving because I need to get back to a project that has a deadline end of the day. And then it could be the family system, keeping everyone in the family on the same page, focused on the same outcomes, still agreeing to the same decisions. And then it also could be the community system. So organizing help at home or help within a facility so that the caree still recovers from that particular decline or change in medical status. So it's not just a hospital discharge, it's a system experience, and it's multiple systems at the same time. And it helps the family caregiver to understand that. It helps the healthcare professional understand that. And the direct care worker experiences these systems in his or her own way. So these are the three concepts that I'd love to share with your employees, with your family members, and within your systems. I think that they could be beneficial to a variety of audiences. I so appreciate you watching, and I'd love for you to reach out with any questions and to schedule time if you feel like this would be a good fit for any upcoming programs, conferences, or events. I'd love to join you. There's my contact information. Thank you for all you do. Thank you for your interest, and thank you for caring. Take care. Bye-bye.
As we are talking about community caregiving here today during the Leading Voices in Healthcare Expo, I wanted to highlight an organization that I think is doing a lot of good for family caregivers all across the country. And with me is Christina Keys, who is the community organizer for caregiving.com. And thank you, Christina, for giving me a couple of minutes today. Tell me a little bit about what caregiving.com is working on these days.
Well, caregiving.com, as you know, is a digital platform that supports family caregivers. And one of the things that we're doing is we are really going in and helping people in their local community. I've worked with caregivers all across the US. I've advocated with caregivers all across the US. And one of the things that they say is the hardest for them to do is to find community resources, community support, and find out about other caregivers right in their own backyard.
Mhm.
And so the way we're doing it, I actually I ran our pilot program for 2 years, a nonprofit called Loving Them Forward, hyper local in Vancouver, Washington. And what we do is we hire caregiving.com champions, which are current and former family caregivers who know about resources, know about, the larger resources, the micro resources, the community support, and they are the eyes and the ears of the cities. Right now, we're in the process of launching 150 cities across the US, and we're building support systems. We're building task force, we're finding local resources, we're engaging and empowering the business owners there and all the support groups there. And it's going really, really well.
So tell me a little bit about the person that you hope finds you and when you hope they find you in their caregiving journey.
I would hope the person that would find us is not only the person who knows that they're a family caregiver, but the person who is the daughter taking care of the mother, the husband taking care of the wife, the mom taking care of the child with special needs, the partner who's taking care of their loved one. There are a lot of people out there. I think about my own caregiver journey, and I was 3 years in as my mom's primary caregiver before I even recognized that I was an actual caregiver, right? And I think about my care journey, and I was so stressed out trying to figure it out on my own. I had a hard time finding resources, and the doctors and the nurses were really wonderful at being doctors and nurses, but they didn't know about local community resources there, and so I had to figure it out on my own. And 3 years into my journey, from all the stress, they told me I had 6 months to live because my body was literally shutting down. And so I had to change careers. And I went into the retirement and senior industry. And my job was to find people who worked with families and seniors in my local town, the same town that I almost died in. I found hundreds of resources and support systems and events and educational experiences for family caregivers, and I was able to bring them together collectively, and that changed my care journey. So what I'm hoping is that whether people are identifying as a caregiver, identifying as a care partner, or just a daughter who loves their mother, or the husband who loves their wife, or a son who's taking care of their mother or father, that they find us and they don't have to go through what I went through. The statistics on family caregivers are 35% of caregivers pass before the person they're caring for, 30% of them pass within 5 years of the person they're caring for, and caregivers who are over the age of 70, 65% of them pass before the person they're caring for. So people are literally dying out there, all in the name of love. So what we're hoping, by building community, we're in no way, shape, or form just looking to be some large directory. We're building community. We're hoping that people who, if you're the person who is taking a loved one in for a doctor's appointment, if you're the person who's signing documents for a loved one, if you're the person who's communicating with the skilled nursing center they're in or the adult family home that they're in, then we can help you on your journey. We can help you find the information you need, the support you need, the resources you need, and the camaraderie you need, because what we go through as family caregivers is tough, right? Like, somebody can say to me, "Oh, don't forget to put your oxygen mask on first." And I say, "Great, where do you find that oxygen mask?" And they're like, "I don't know." But somebody who's a family caregiver is like, "Well, let me tell you, because I've walked through that journey myself." So
That sounds like a lot of work, and I'm interested in the ways that you are trying to stay like hyper local and small and kind of community focused. Because this expo is reaching across the country, how would people be able to kind of engage with caregiving.com to sort of see if you're present in their community yet?
So you can always check caregiving.com. You can always reach out to champions at caregiving.com. And you can always text 360 230-7736 to find out if we have a community being built in your local town. Again, this year, we're focusing on building 150 cities across the United States, and obviously we'll be building more in 2024 as well.
Wonderful. Thank you for that. As you did this first as an individual, and then you have turned this into your profession and you're working with caregiving.com, what is it that you hope that hospital healthcare professionals can add to their support of family caregivers? If you were going to give them one thing that they could add to make it better, safer, kinder, more reliable, what would you do?
Well, first of all, I just have to say, I love the doctors and the nurses and the CNAs who were there to support not only my mother, who I cared for 10 years, but my ex-boyfriend, who I've been caring for since 2019. Having brochures for caregiving.com, educating, your discharge planners about resources like caregiving.com, things like that. So they know that they're not alone. You know what, if you don't know this, there are 53 million unpaid family caregivers in the United States. That a lot of those people who are coming in that have special needs have a family member that's taking care of them. I'm sure you're communicating with them probably 80% of the time rather than your patients, right? And so, you don't have to figure it all out. You get to do your job well, you get to save lives, and you can turn it over to the people who are taking care of those patients in between appointments. And it's people like caregiving.com who's building communities when they're going home to their homes. Those family members, they need a place to turn to, and they can go to caregiving.com because we need to partner together. We need to be a team, right?
Yep.
Me and my mom used to say team mom, and that included the doctors and the nurses and the CNAs and all the support groups and all the community resources in town too. That was team mom.
Yep. Well, thank you so much, Christina, for spending a couple of minutes with me. I really appreciate it. And so it is, I'm going to ask for the phone number again in just a second, but it's champions@caregiving.com, caregiving.com as a whole website. And then what is the number we can text again, please?
It is 360
Mhm.
230-7736. It will ask for the city and state you're in when you text that number, and you'll be getting a hold of me, and I can certainly help you find out what we're doing in your community. And also another option, if you're looking to find out if we have community built for you, the National Family Caregiver Summit is coming up November 10th and 11th, and it's a virtual event, and you'll start seeing that on caregiving.com as well.
Wonderful. Thank you, Christina. Thank you so much for spending some time with me today. I really appreciate it. I hope you have a good one.
Thank you. Have a great day.
Take out your cell phone. On your cell phone, pull up a picture of a person that you love more than life itself. It might even be your screensaver picture. Now imagine you and your cell phone person are traveling to a foreign country, let's say Egypt. You and your cell phone person are in Egypt, and suddenly your cell phone person becomes critically ill and ends up in a hospital in Egypt. How are you feeling right now? Scared, yes. Anxious, fearful, out of control, yes. And what is it that you are feeling fearful, scared, anxious, and out of control about? What are those things that you're worrying about? Are they going to be okay here? Yes. Did I make a good decision coming to this hospital? Are they going to be safe? Are they going to be nice to us while we're here? What's this going to cost us? How long will we be here? When am I going to be able to take them home, and how? Am I going to understand everything they're saying to me here in Egypt? Every day, people walk into your doors and they're feeling scared, afraid, out of control as well. And they're wondering, because our hospitals are a foreign country to people who don't live in them. We live in our hospitals, our healthcare system. Other people walk in our doors, and it's a strange world. We speak a strange language, right? We do things that are different than out in the outside world. And they're wondering, are they good here? Did I make a good decision coming here? Are they going to be nice to me? Is my loved one going to be okay? When am I going to be able to take them home? What's this going to cost me? And most importantly, am I going to understand what they're saying to me? Because even if English is their first language, don't we speak a little bit different English in our hospitals? We do, don't we? And people are wondering, will I understand what they're saying? So why is it important to know people walk in our doors afraid? I want you to imagine for just a moment, and maybe you really are, afraid of snakes. Imagine there's a snake on top of your head. Maybe it's a rattlesnake and he's shaking his rattle on top of your head. And I come in and I say, I have really important things I need to tell you so you can take care of yourself when you go home. How much are you going to hear when there's a snake on your head? Probably nothing, right? Well, every day people walk in our doors afraid. We've already said that. We tell them important things they need to know, and they can't hear us because they have a snake on their head. Well, in 2018, 4 nurses helped me interview over 220 families about their fears when they walked into our doors. And they were afraid of all the same things that you all just mentioned that you were afraid of. But more importantly, we asked them, what's the most important thing we can do to help you with your fears? And you know what we learned across the board, inpatient, outpatient, ambulatory, and surgery and ER, they said, keep me informed, keep me safe, and keep me comfortable. Well, I think I've just proven to you that we have to do the second and third thing first, right? They have to not only be safe with us, we do keep people safe, but they have to feel safe with us. They have to feel comfortable with us so that they can hear all the good information we're telling them, right? And so what I want to share with you is that there are some very simple things that we can do. It doesn't cost any money and it doesn't take any more time. I know people don't have any extra time and you're thinking, oh my gosh, what's Mindy going to ask us to do now? In fact, I think it may actually take us less time because if people can feel safe with us and feel comfortable with us, they can hear us. We don't have to go through all of it again later, right? And so the other thing I want you to know is that in March of 2020, one of my very favorite nurses, her name is Rachel, and she said to me one day, Mindy, I'm so worried I'm going to make mistakes. I can't focus. I can't concentrate. And I said to her, oh my gosh, Rachel, you have a snake on your head. Now, I had been talking about this for years, so Rachel knew exactly what I meant by having a snake on her head. And she said, you know, you're right, I do. Well, if you think back to March of 2020, what did we do? We said, this is all you have to do to be safe with this virus. And then the next day, or maybe an hour later, we came in and we said, well, no, this is what you need to do to be safe with the virus, right? The information was changing constantly. And what did Rachel and all the rest of the team need? They were scared and they were thinking, keep me informed, keep me safe, and keep me comfortable. Well, I realized at that moment that there are other times the healthcare team, things I had been doing for years, and it all made sense now with the snake. There are other times when the team is afraid and it impacts the outcomes and it can impact patients even though nobody ever intends it to. One is when you get a new leader. I oftentimes would see results would start to fall when a new leader came in because people were afraid. What are they going to change? Who is this new person? What do I need? And I would do transition workshops to help people get to know that leader and that leader to get to know their team faster. And the results would go back to where they were or even better. Another time is when you have a new job, right? It's a scary time. And when there's significant change. So there are things we can do to help our team as well as our patients and families through times that cause us to be afraid. The other thought I want to leave you with is that I think today we see a lot of anger in the world. And what emotion usually sits right under anger? It's oftentimes fear. And we are wired, our ancestors wired us with the response to anger is to push back or to flee. And neither of those are really going to help someone who's afraid. But if we can focus on the fear that's underneath that anger, that hits our compassionate, caring cells in healthcare. And we can help to get rid of some of that anger so they feel safe with us and they can trust us. So if we can learn to see snakes on people's heads, including our own, what is it that might be holding you back right now from what you'd like to accomplish? I think people in healthcare have the chance every day to make a difference in people's lives. We do. And here's one more way, I think, by looking at how can we decrease fear and anxiety in healthcare. Thank you.